Hi, my name's Ryan Cooley, and I am going to talk about the rural community health concerns today. Moving on. Okay, so the rural community includes counties with no cities over 50,000 people and that are not significantly affected by urban growth. When asked, are they vulnerable? The answer is yes. There are lower percentages of general practice physicians compared to urban areas, larger amounts of individuals in poverty, and larger amounts of individuals without a bachelor's degree. There are also transitional counties, which are next to urban counties, that are connected to urban counties with a main interstate. And they have populations over 50,000. And those transitional counties are also considered rural. And then the opposite of rural would be urban. And urban counties have populations over 150,000. Like I said, it's important to realize that transitional counties are still recognized as rural counties, although transitional counties may become more urban in the near future. And the rate of doctors to potential patients in rural areas or in any area, is indicative of the person's access to healthcare and the quality of the healthcare system. Moving on. So statewide, well, locally first, Weber State University is located in an urban county. Then statewide, there are 16 counties in Utah that are rural and 9 that are transitional. The rural ones are Rich, Millard, Beaver, Kane, Garfield, Wayne, Emery, Paiute, Sevier, San Pete, Carbon, Duchesne, Daggett, Uinta, Grand, and San Juan County. Nationally, about 46 million people live rurally, and internationally, about 45% of the population is rural. When comparing nationally to statewide, nationally there's about 12% of the population that lives rural, and statewide about 14% live rural. In Utah, let me see here, about 6% of Utahns live rurally and 8% live in transitional areas. That means about 330,000 Utahns are considered to live rurally. So the social determinants of health for the rural community. The rural poverty rates are higher than urban poverty rates. The median household income for the rural community is around $50,000 a year, while urban families are bringing home around $65,000 a year. Only 17.9, almost 18% of rural individuals have bachelor's degree or higher, while 32.4% of urban individuals have a bachelor's degree. And then, as we talked about, there are low ratios of physicians to populations, especially in the rural area. Nationally, there are about 29 doctors for every 10,000 people. In Utah, there are 23 doctors for every 10,000 people. That's an average. And in some rural counties like Summit and Grand, they both have 12 doctors for every 10,000 people. But in other counties like Daggett, Paiute, and Rich, there are no doctors that live or practice in those counties. So individuals wanting to see a general practitioner would need to commute. Contributing factors to those concerns are, at first, an access to health care. Second, a lack of health insurance, and third, a lack of resources. As of early 2019, Utah has 13 critical access hospitals, 14 rural health clinics, 19 federally qualified health centers, and 8 short-term hospitals in rural counties. According to the Rural Health Information Hub in 2018, around 9% of Utah's population is without healthcare insurance. So I found that the number one root cause or contributing factor, the root cause was a lack of resources, lack of physicians for the population, lack of nurses, lack of facilities, lack of supplies, lack of education, and lack of money. Many of the people many of these areas are remote, and there's just not an adequate number of readily available resources for each individual. The people that need to commute to the people will need to commute to the nearest emergency hospital, or if they're planning doctor's visits, they may need to plan overnight trips. These overnight trips can become expensive when adding up all of the necessary costs. As far as Maslow's hierarchy of needs for the rural community, depending on the other contributing factors, if we just take it as the rural community, possibly living in poverty, most will have their physiological needs met, along with their safety needs, and their belongingness and love needs should be met. But unmet would be the esteem needs and the self-actualization needs, and we'll get to that further down in the PowerPoint. These individuals may express low mental health status and will likely have to travel to receive any mental health or health care in general, and because of this, they may not meet those needs. And if they have other contributing factors, they may not even meet some of the ones that I put under the MET category. Excuse me. All right. I found a study that discussed in 2017 more than a dozen people from a small community in southern Utah were hospitalized with sugar toxin producing E. coli. It was first acquired from cow manure and then spread from person to person, and it happened in a multi-family home with upwards of 40 people living in the home, and 2 children did end up dying from the complications of the illness. They found that there were several contributing factors that led to this, from lack of awareness of the disease to inadequate hand washing and hand-to-mouth behaviors. They also found that encouraging hand washing, providing adequate education, and other hygienic behaviors could help in preventing this again, as well as preventing other non-communicable diseases or infections. As far as self-care and self-harm, this is what I was discussing earlier. There is many rural counties. Let's see, hold on. So statewide in Utah, 14.7% of teenagers have self-harmed within the past year. So we can kind of spread that out, and if we just take that in all of Utah, there's 14.7%. But many rural counties in Utah report having fewer than 5 mental health workers total, and a couple of counties, like the ones previously mentioned, report having none. There are 13 counties in which there are none. There are 0 licensed psychologists, and the number one way of preventing self-harm and improving self-care is with cognitive behavioral therapy, which takes multiple sessions, and for many of these people that are living in these rural areas, they would have to drive a long ways to be able to receive that treatment. Next. Risk for harm by others and to others. So when looking at the crime in rural areas, found that there is less crime in rural areas than in urban areas. And this is due to the size and composition of the population, as well as the economic status, the cultural conditions, and the strength of law enforcement, as well as some others. Because the density and size of rural areas is less than in urban areas, these counties tend to have less crime, resulting in less risk for harm by and to others. Areas with high transient populations, which tend to be in rural populations, may have higher crime rates. And last is my reference page. All right. Thank you for watching.